All right, time to have more discussion on World Tuberculosis Day. I'm being joined by Dr. Olakunle Daramola, who is an Assistant Director with the National Tuberculosis Program. Are you welcome to Nationwide?
Thank you very much, sir.
Now, let's have your thoughts. This particular disease is treatable, yet many people still keep dying.
Yeah, so thank you very much. Basically, it boils down to most people not being aware of what is freely available. So tuberculosis is preventable, it's treatable, and it's curable. That is, after some months of treatment, the person is cured. In fact, after the first 2 weeks of being on treatment, the person cannot even spread it any further. So we just need to be aware of the basic symptoms, just like it has been said: cough of more than 2 weeks, night sweats, weight loss that is unexplained, and fever most times. So it also affects children, and that is why we also have to take this very seriously. And then for those who don't take their medicines properly or who interrupt during the course of treatment, it can give rise to what we call drug-resistant tuberculosis. So there is a lot to be mentioned. There is a lot of awareness that we need to do. Government has done its part. It is free to test yourself for tuberculosis. It is free to treat, and everything is available in health facilities. For instance, you can just dial *3340# on your phone right now, anywhere in Nigeria, and then you get more information, even about health facilities around you that offer all these free medical services on tuberculosis.
Now, there still could be some people who might still be having different form of reservations about orthodox treatment of some of these, particularly tuberculosis. How is the campaign strategy being positioned to reach out to them, to make them know that health surely is wealth?
Yes, so the government is reaching out to communities. We don't just stay in the offices, that's why we're here. And we also go into communities, reach out to, for instance, patent medicine vendors, people that we call chemists or pharmacy stores. Because most times when people are coughing, when a child is coughing, a mother usually takes the child to those kind of places to complain about cough and probably get cough syrup, which will not solve the problem. So we engage them, and then we engage other people in the community where people interact in the community, and then we train them such that they can refer. They can be the bridge between the community and the health facilities. So we're not resting on our horse. We're improving in case notification. Nigeria is improving, and then by the next few days, we're also going to we're going to take the advocacy to a higher level, involving all the first ladies in the country, including the first lady, the president of the wife of the Nigerian president. So we're not resting. We're moving into communities. We're moving into different places, the media houses, to make sure that we shout as much as possible and get people involved, and make sure people also don't get stigmatized.
How much of reduction do we expect to have in terms of cases of tuberculosis before we come and celebrate the 2025 World Tuberculosis Day?
Okay, so basically we have an estimated target of between 400 to 500,000 cases that we expect to find. And then, but now we're moving, we came from maybe 20, 30%, now we're moving towards 70%. So we're moving towards the target, but at the end of the day, we're not resting until we reach 100% and find every TB case wherever they are, in a child, in a woman, in a man, wherever they are. Whether the person is an executive, the person is a laborer in a construction site, anywhere they are, we're taking the services to them. And then until we make sure that nobody is coming down with tuberculosis, that's when we can believe we have achieved our target. We're also talking about prevention, cough etiquette when people are in public places. We're also talking about making sure that we look at things that drive tuberculosis, things like malnutrition, things like smoking, things like diabetes, HIV. All of those things, we're using a whole of government approach to make sure that we involve other agencies to make sure that we tackle anything that might also continue to drive tuberculosis in our society. Thank you.
Now, Dr. Olakunle, now that you've mentioned some of these elements, including smoking and some other items, some have the belief that not getting involved in some of these vices will surely not make them susceptible to tuberculosis. How do you address that?
So basically, I would want the audience to understand that there's a difference between tuberculosis infection and tuberculosis disease. Actually, somebody can have the infection, that is, the bacteria is there, but you're not down with the disease. Now, when you engage in smoking, when there are other things that depress your immunity, you don't eat a good food, at the end of the day, it depresses the immunity, and then the disease shows beyond the infection. So it is important that while we're tackling tuberculosis, we keep an eye out for things that can make the situation worse and make sure that we address them. And also we need to make sure that we support the patients, people who have it, so that they can proceed on their treatment and complete the treatment so that we can stop the tuberculosis spread in the community.
So the message is obviously clear. Cough that persists for 2 weeks.
Yes.
Get tested.
Yes.
The treatment is clear. Dr. Olakunle Daramola, I would like to thank you for coming on Nationwide.
Thank you. My pleasure.
Of course, Dr. Olakunle Daramola is an assistant director with the National Tuberculosis Program and will be speaking on the World Tuberculosis Day.